right, Dr. Stahl, I really do appreciate your patience. If it works for you, let's have you come up. Yes, ma'am. Thanks again. All right, I've got some questions for you, and I just,
Okay.
if it's all right with you, let me start with those, and then I'll give you the floor to give us
Okay.
any other update.
All right.
So thanks for agreeing to come out to speak today. There's some conspiracy theorists out there who say that masks don't work. As a multi-decade clinician and as the highest-ranking Florida Department of Health official in Brevard, do you have any question whatsoever that masks reduce transmissibility?
No, I don't. And I can say masks obviously are not the only answer. We need to use masks in addition to the social distancing and avoiding the crowds. But masks will decrease transmissibility. We've never been in a situation like we are right now. I mean, I don't think we've ever in our country had a pandemic like this where masks were being advised. But masks definitely, it's their barrier that's going to stop the aerosol transmission.
So if we don't somehow either encourage or require increased masking, do you have any doubt that we'll have either greater COVID-19 spread, let's say, as opposed to doing nothing?
I think we will have a greater spread. Some of the spread that's going on right now are in the pre-symptomatic and the asymptomatic individuals, and also the younger population. So not wearing masks will definitely increase the transmissibility to others, especially not just the vulnerable population, but the vulnerable population and the elderly are the ones that are most at risk.
So as you've indicated that masks do in fact reduce the transmissibility, given that one has to be infected with COVID-19 to die from it, would it then make sense to say that lowering the transmissibility would likely lower the death toll?
Yes.
So encouraging or requiring masking, whichever may be the case, could literally save people's lives?
Yes, it could.
So I want to go back a bit, if you have the data, and if you don't, that's okay, to July 1st, the day after my proposal for universal masking failed. What have you seen with respect to an increased death toll from that date, from the July 1 date?
I was going to say, that's some of what I was actually going to report out on. So I can tell you since July 1st, our deaths have increased by 33. Our cases have increased by 2,342. And the cases in our long-term care facilities, it's increased by 18 facilities. Do you want me to actually go from July 13th, which is just a week
Sure.
ago? Just a week ago, we've increased our deaths by 21, our cases by 794, and our long-term care facilities are up to 20.
What about with respect to positivity rate over either period of time?
Our lab positivity rate is variable. Since July 1st, the range actually since July 7th, it's been from 5.3 to 11.4. So it is overall our positivity rate is 6.22. So, but it varies on any given day.
Okay.
Yesterday, our labs reported out at 5.5%, which really, truly was a low point compared to what we've been having. But I don't have it right in front of me there.
Well, let me ask you another question. Do you recall the last time or the last day that we had a report come out that didn't have any COVID-19 deaths?
Yesterday, but that's truly not. We did have deaths yesterday. So to explain a little bit how it works with the deaths, even with cases. They get reported out from the labs, but the labs then report into the state system, Merlin. So that's not to say the investigation waits necessarily until it's in Merlin, because if we get a faxed lab report from anybody, we will start to take action on it. But it doesn't actually get reported out till it's in the state system. So yesterday there were none that were verified in the state system, but I know for a fact we had deaths.
Okay, and prior to that, do you recall the last time we had a day that there were zero reported, even
No,
if there
it's
were
been
in
a little
fact?
bit. It's been a little bit of a while ago. We've been having pretty consistently deaths every day. Some days as high as 5 or 6.
I think we've had several days with at least 5, have we not? Mm-hmm. Mm-hmm. Do you recall offhand how many deaths we had over this immediate past weekend?
Well, I can tell you what's reported to us from the medical examiner's office.
Sure.
All those have not come through as labs. The labs have not come through to us yet, nor has it been reported out in Merlin yet.
Okay.
But the medical examiner's office yesterday did tell us we had 20 deaths over the weekend, and we had 5 yesterday. I do know out of those 20 deaths, 4 of them were actually Indian River County residents, so they will not show up.
So 16 then?
Yeah, but I can also say, in addition to that, is we have not seen the lab reports on that yet. So that's just a verbal report from the medical examiner's office.
I appreciate that. And I'm sorry for kind of starting it off this way. I know it's a little atypical. Is there anything else you want to let us know in terms of numbers or status?
Well, let me see what I have here, and we'll see what I haven't reported. So yesterday, yes, we did have 4,304 total cases, and that was up 84 yesterday. I already reported out in the lab positivity rate. Our long-term care facilities are really a concern right now. Yesterday, we had 41 long-term care facilities. Again, that's out of 168 that have had cases. There's 239 residents and 174 staff that have tested positive. There are a few facilities that we're a little more concerned about, and we're working with ACA and the state on those facilities. I've already reported out here on the deaths. I can say the median age, last time I reported to you all, the median age was running between 20 and 40. That has increased a little bit to 40 to 50, so we're seeing a slight increase in the median age. The age of our deaths are from 56 to 101. We're fortunate in this county. I mean, no death is fortunate. And I feel for all the families. But there have been children that have died in the state. So I think there's 4 children under the age of 18 that have died statewide. Our labs, the lag on our labs is running between 5 and 7 days right now. I think last time I reported it was 7 to 10 days. And our testing, you know, the state goal is 2% to be tested per month. This month so far, we've tested 5%. So we're really way up there. We have tested about 11% overall. And then just to reiterate, the mitigation measures, and the number one thing is stay home if you're sick. That is the most important thing. If you're a worker or just going to the store, whatever, stay home if you're sick. If you do go out and close public places, wear a mask, practice social distancing, good hand hygiene, and avoid the large crowds.
I appreciate it. Commissioner Tobias, you have a light on, sir.
Thank you, Mr. Chair. And I wanted to avoid this, but it appears, though, that you were trying to qualify Ms. Stahl as an expert on this when it came to masks. So I do have some questions for Ms. Stahl.
Sure, please.
At our last special meeting, Commissioner Lober said to the public, quote, "Please let the commission know if you are licensed to practice medicine in the state of Florida, or we may simply assume that you're not, and your opinion will be weighted accordingly. Also, if you are a physician and either an MD or a DO, please let us know so we may refer to you as a doctor." So my question, Ms. Stahl, are you a medical doctor or a doctor of osteopathic medicine licensed to practice in the state of Florida?
No, I'm not.
Okay. On March 3rd, your office held an in-person briefing in the EOC where the room was filled to capacity, in which you explained the importance of taking basic precautions and distancing. During this meeting, the impact of the cruise industry was mentioned. Did you go on a cruise the following week?
Yes, I did.
After returning from the cruise, you were forced to isolate for about 2 weeks. Is that correct?
Yes, I was.
Are you aware the CDC has issued a no-sail order because, quote, "the outbreak of COVID-19 on cruise ships poses a risk for rapid spread of disease beyond the voyage and into the communities across the globe," unquote?
Yes. And the cruise I was on was the last week of sailing.
I don't know that that helps your argument.
No,
Thank you,
and I'm just-
Mr. Chair.
And
Appreciate it.
just, let me say one other thing. I did get approval from Tallahassee before I did go on that cruise. So I just wanted to let you know that I had the cruise planned, but 2 days before the cruise, I did get approval to go. So I just want to put that out
So the
there.
no-sail order didn't apply at the time that
The
you
no-sail
left?
order did not apply at that time.
And when it said that you were forced to isolate, were you legally obligated to isolate, or did you do that because that was the responsible thing?
That was the rules of the Department of Health at the time. When I came back, yes.
Okay.
And I did, and I worked.
Since March 3rd, because that was a date that was brought up, has any of the guidance either from FDOH or the CDC changed?
Since March 3rd?
March 3rd, I think that was a date that was
Yes,
brought up.
oh, yes. Things are changing every week, yes.
Okay, and then in terms of what your doctorate's in, what is your doctorate in?
My doctorate is in nursing practice and leadership.
Are you entitled
executive
to write
leadership.
prescriptions?
No.
Can you offer advice regarding matters that fall within your area of practice?
Yes.
Is there anyone within Brevard County that is consistently here that's a higher ranked official with FDOH than you
In Brevard County?
in Brevard County?
Not FDOH. No, we have our medical director that works alongside of me, but
So really, you're the top dog
he
in Brevard County?
reports to me, yes.
I appreciate that. Anything else that we missed?
Not that I think, unless anyone else has questions.
Anything further? Commissioner Tobias, do you have anything else?
Sure, Mr. Chair.
Please.
Ms. Stahl, I'm looking at Dr. Stahl. I'm looking at an article in which you advocated, not advocated, but spoke in favor of the AAU Junior Olympic plan coming down.
Yes.
In your expert opinion, will bringing tens of thousands of people increase or decrease the spread of COVID in Brevard County?
It could potentially increase.
Thank you.
Along with any crowds.
Thank you.
Yes.
Let me ask you, Dr. Stahl, so if adequate measures are taken, namely they don't have wrestling at events where social distancing is impossible, they keep people 6 feet plus apart and they wear masks where appropriate, would that do anything in terms of assuaging concern that transmissibility would become a
Well,
concern at that point or a
What I
problem?
can say, I reviewed all the plans and I made the same comment on every single plan. And the crowd size should be less than 50. And I said that on every single plan. I can also say that each sport developed their own plan, and the plans are very good. They are cleaning with the biotech. They are, wearing masks. They are screening spectators, visitors, athletes coming in. Each sport, one might have had one comment versus another. But on every single one, I did advise limiting the crowds to 50 or less.
And let me ask, with respect to what you said today and everything that's been referenced in the exchanges with Commissioner Tobias, have you ever taken a position which is contrary to FDOH or CDC stances?
Not that I'm aware of, no.
I appreciate it. Thank you. Commissioner Tobias, is that a new light, sir? Okay.
Thank you. Just a
Please.
follow-up to your question on the AAU. If precautions are taken, is the AAU taking any precautions with the participants prior to their transportation to Brevard County? Will they be testing them before they get on planes, before
If
they
you
get
don't
on
know, don't
cars, before
speculate.
they come?
I was going to say, I don't know, and that's probably a question for Rusty Buchanan.
So in other words, if they were not, and it's a fair assumption, I mean, you said, and I quote, really thought this plan through very well, according to the paper. And it's not listed here, then if we identified them as COVID positive once, not before they came, we could have new COVID people, people with COVID in Brevard County, correct? They would not be able to participate potentially, but we would have more COVID people
You
with COVID.
potentially could with any crowd, with anybody, yes.
Okay,
With our visitors coming into our beaches and our hotels could be the same thing, absolutely.
thank you.
I appreciate it. Thank you, Dr. Stahl.
Okay.
All right, I don't know if we have Dr. McPherson in. Come on down, sir. And just for the clerk's benefit, what city do you reside in, sir?
Melbourne Beach.
Melbourne Beach? All right, I've got some questions for you, if you don't
Sure.
mind. I appreciate your accepting my invitation to come out to speak today. So you graduated from an accredited medical school in the United States, did you not?
I did.
2020, this year marks your 30th year of having been licensed to practice medicine in the state of Florida, is that right?
That's correct.
And you're in good standing with the Board of Medicine?
Yes,
You completed a residency in emergency medicine with the University of Florida, am I right?
you are correct.
And you're board certified right now in internal medicine and a fellow of the American College of Emergency Medicine, is that correct?
It's actually emergency medicine is a
Emergency medicine,
specialty,
right.
so board certified in emergency medicine.
I apologize for misspeaking, emergency medicine. Prior to being accepted into medical school at the University of Pittsburgh, which I believe is ranked in the top 15 nationally of all medical schools, you completed all the coursework at University of Pittsburgh's master program in public health. Isn't that right?
That's correct.
And separately from those two programs, you also have a postgraduate master's degree from FIT, don't you?
I do, in business administration.
So, well, you're trusted to serve as the emergency medical services director for at least 4 beachside municipalities in Brevard County. Isn't that right?
That's correct.
But you're not here speaking on their behalf, right?
I am not.
So, interestingly, you're also Brevard County Fire Rescue's emergency medical services director, essentially the county's own emergency medical services director, are you not?
I am.
And obviously, you're not speaking on behalf of BCFR, correct?
I am not.
So let's get to the issues at hand, and I'll try to keep it pretty succinct. We've got, I believe, one of your handouts or your slides up here if you want to reference it at some point. Are you familiar with any recent studies pertaining to microdropules, if I could speak English this morning, produced by the coughing of COVID-19 infected patients?
I am. There are 2 studies. One study is from the University of Atlantic here in Florida. It's a 2020 March study, and they looked at the distance that microdroplets could be expelled with various types of masks and no mask. And they were able to measure, on average, 8 to 12 feet with no mask. These microdropules would be expelled forward. If you had a simple one-ply mask or a handkerchief, that was blunted to about 3 feet. If you had a 2-ply homemade mask, that would stop the microdroplets from passing any farther than 15 inches. If you had a commercial made 2-ply to 3-ply mask, that would allow microdroplets to go maybe 3 inches, 4 inches. Now, your surgical mask and your N95 respirator will not allow any microdroplets to expel past the mask.
I appreciate it, sir. Now, we've heard from a lot of folks who graduated from the social media school of medicine regarding the efficacy of masks. As an American-educated and trained, board-certified, multi-decade, 3-decade emergency medicine physician who's trained as well in public health, would you please speak on the level of consensus that exists amongst the group most qualified to render expert opinion as to medical issues? And as Commissioner Tobias pointed out, you are a physician and MD. Physicians, if you could speak as to the level of consensus amongst them that masks truly help reduce coronavirus spread?
One of the things that I think we all noticed when we were seeing broadcasts from South Korea, from Singapore, everyone wore masks. And at that point in time, we didn't think it was necessary to wear a mask in the United States. We didn't think the prevalence was that high. And there were some issues with, I think the Surgeon General stated that they may be helpful and actually cause further infections because the average person is not putting the mask on right, will get a false sense of security, they don't have to social distance, and a variety of other things regarding just a sense of comfort and therefore relaxing your hand washing, so forth. There was a about face on that position as the prevalence of the coronavirus, COVID-19, was noted to be much higher than we thought. We have very many asymptomatic and minimally symptomatic cases. So at that point in time, it was determined that a mask barrier was definitely necessary to avoid continual passage of microdroplets from person to person, especially when people didn't think that they needed a mask because they didn't feel ill. So there has been a lot of what we call asymptomatic spread that has exceeded all of our expectations. This is one of the very difficult things with this virus is that you can have a 14-day incubation period before you have symptoms, and during that period of time you can be infective. So it's kind of breaking all the rules with the usual kind of virus protection that we are used to. If someone's sick, they put on a mask and you stay away from them. So this is why this is very tricky and why wearing a mask to diminish the spread of the asymptomatic patient to the rest of us is really vital to controlling the level of, or the rate of this infection. So when you wear a mask, it's not to protect, when I wear a mask, not to protect me, it's to protect you and vice versa. And we have a risk factor group that is impacted really dramatically if they do develop the COVID-19 infection. I'm 60, I have some non-insulin dependent diabetes, and I'm very concerned. I make my son wear a mask. His friends, only 2 or 3, can come into our house. And if anyone's sick, they can't. So to me, I think this is critical for us to wear masks, to protect ourselves, to protect our loved ones. And it's very clearly shown to stop the transmission of COVID-19.
So I want to ask you a couple questions I didn't intend to ask you, but as Commissioner Tabaya at least implicitly questioned whether a nurse practitioner is qualified to render certain medical advice, you have an MD from a very solid school. You're licensed to practice here. I'm going to ask you a couple more, if that's all right, sir.
Sure.
So you've just mentioned that transmissibility would be reduced by masks. Given that someone has to be infected with coronavirus, in this case COVID-19, in order to die from it, by extension, would it not be fair to say that by mandating or encouraging masks, we could also prevent deaths?
That would be a correct assumption, yes.
I appreciate it. And then, you know, I'll leave it at that. I don't want to take up too much time rehashing things. Commissioner Tabaya?
Thank you, Mr. Chair. I was not meaning to diminish the credentials that are clearly far more than what I have on that as Ms. Stahl as a medical practitioner. I was just citing the information you did at the beginning of a meeting.
Appreciate that.
And I had absolutely no condition. I didn't know we were certifying these people as experts. But Mr. Ramsey, would you like to talk about Judicial Case 052016 CA 031577, a settlement date on what is that, February 27, 2020, in which your insurance company or you were found liable in the amount of, it looks like $250,000? Am I reading it correctly? I'm looking at the Department of Health. John Ramsey McPherson.
Is there a specific question for him?
I have an incident date. You were qualifying him as an expert, were you not? You
No, it was
asked
just
about all his credentials, correct?
I did ask about his credentials. I
And
don't think we're in a...
I'm looking at the Department of Health, and it sounds like all of that stuff is correct. I just had something on here that I didn't quite understand. There was an incident date, there was a settlement date, there was an amount, and I was just curious, because that was the one thing that was not listed that you talked about. I have the license number, the beginning of practice, it all mentions.
Here,
I'm just curious. You don't have to, I'm just,
Sure, no, I can absolutely help with respect to that. And I know nothing about that until you mentioned it.
Neither do I. I'm sorry, that's why I asked the question, Mr.
Right,
Chair.
and I mean, I like specific questions rather than these open-ended ones. Are you in good standing with the Board of Medicine?
Yes, I am.
Do you have any discipline on file with the Board of Medicine?
I do not.
That's sufficient, sir?
If you'd rather not answer the question, I understand.
How many individuals do you have that are subordinate to you with respect to being subordinate to your licensed PAs and the sort?
No specific PAs. The EMTs and paramedics work under my license, and that's about 600 to 700.
Okay, so 600 to 700 people are under your license?
Mm-hmm.
And by extension, if one of them did something, that could result in a claim on your insurance?
Could, yes.
I appreciate that. Commissioner Pritchett?
Yeah, I just want to say I'm starting to feel like I'm on the Perry Mason show.
I'm sorry.
But it's not yours. Commissioner Lober, though, are you trying to go somewhere with this, if I may find out where it is you're trying
Sure.
to head to? So.
No, I just wanted to get this in there as a courtesy because I've asked them both to come to try to get them in and out as quickly as I could. I will bring it up in board reports. I did see that there was a speaker's card with respect to the same issue. But I did want to get these two speakers in and out because as a courtesy, they came here. Anything that we didn't touch on that you think is important for us to know, sir?
I would just say a word of caution and on a positive note. Word of caution is we've really never had this surge stop. It's continuing to escalate. It should have stopped. This is a seasonal infection, and it's continuing to spread at a higher rate. My colleagues down in the South Miami, West Palm, medical directors, their EDs are overrun, their hospitals are diversion. I hope we don't achieve that yet here. The good news is there's about 3 medications. One came out yesterday from England, which can decrease by 79% the chance of dying or going on a ventilator if you're an ICU patient. In the first experimental trial, we have dexamethasone now for ill patients that are having respiratory distress. It decreases their chance of having to go on a ventilator by 30% or more. And we have this convalescent plasma, which essentially is antibodies that have been extracted from blood from people that have had the coronavirus infection, and they're able to generate multiple antibodies by essentially churning T cells, causing their DNA to just produce many more antibodies. And this is in phase 3 trials, and these are things that are not a vaccine, but I truly believe are going to mitigate until we can get a vaccine. The very positives on the vaccine line, Oxford and AstraZeneca have had very positive third clinical trials, level 3, reported yesterday with 100% antibody response to these antigens, and 100% of the patients develop T cells, which generate the antibodies. So a lot of positives out there, and we just need to mitigate, wash our hands, social distancing, and wear masks until the time we can get those vaccines out.
Commissioner Isnardi, so you have a question? Please.
Admittedly, you know, I'm not obviously Dr. McPherson, but I do hold a doctorate in nurse practice. I work in family practice. Will you admit, you know, over the course of the last several months that this virus is not just the projections, the predictions, the course of the virus, the infection rate and everything is changing by the week?
Definitely.
The recommendations from the CDC have been changing by the week? Do you think that the death toll they predicted in Brevard County, I think there was some experts, medical experts, as well as plenty of politicians that said Brevard County was going to see 10 to 20,000 deaths within the first 2 months, that sort of thing.
We have 50 deaths at this point in Brevard County. For wonderful reasons, we've been kind of spared compared to our neighbors in West Palm and Brevard, but even in Orange County. But the infection is going to move our way. We're going to have higher and higher numbers. It's inevitable. Then we're going to have flu season on top of that. So I'm looking for a very difficult next 3 or 4 months with increasing cases, complicated by flu, which is it. So it's going to be, Brevard's not going to be spared.
And I personally think that this virus was here long before we started to get excited about it. Because, I mean, I had plenty of patients, and I'm sure you have, or you've heard, even through the ER, that tested negative for flu A and B that were laying on your exam table. I've been in that situation, so I can only imagine that probably many of us have the antibodies for those already. That's sort of a sidetrack there. But so would you recommend, I mean, if you were the decision maker, would you recommend that Brevard County government mandate masks for all of its residents? And how would you suggest we enforce that?
Well, enforcement would be very difficult. I don't think law enforcement would want to be in the business of arresting people who didn't have masks. There can be fines associated. That's a real hard one to deal with, enforcement.
Would you recommend that we mandate them then, as government? Would you recommend that we pass an ordinance that mandates masks across the county?
Well, I think a mandate without ability to enforce is in a way a non-starter. I think what does a mandate mean to you? Mandate means some sort of enforcement. Do we have that plan in mind?
So yes or no? I mean, I'm not trying to be a lawyer. I'm just saying, would you recommend that we pass an ordinance if you had the decision ability or you had the authority to make that law? Would you recommend that we pass an ordinance that mandates masks?
And you can assume that we'd be able to enforce it for purposes of that, because I think that's where your hesitation appears to come in.
I would recommend that we would encourage wearing masks in any way that we can that would enhance the protection of our citizens.
Okay, and what about a vaccine? If the government, I know that they're sort of rushing these trials, which is a little scary to me, because I'm sure you've been reading some of those trials, and they're a little scary, what's happening with some of what's going on with the vaccine. Would you be okay with a government mandate on vaccination for the COVID-19? Or mandated forced vaccination?
Well, I'm a bit of a libertarian in a way. I don't think that a mandate for forcing people to get a vaccine has not seemed to have worked up to this point in our history that I'm aware of.
And I agree with you. I'm just asking
So
because.
I think that would be problematic. I think encouragement, social expectations, and good education, I think would be.
Because that's sort of been my message to people as well, and that's how I know that's how we practice. We check temperatures at the door. We all wear masks, 10, 11 hours sometimes wearing a mask. I can't tell you what that does to your skin and to your breathing, and you get headaches and everything else, which is fine if it's protecting my patients and it's protecting my coworkers. So I agree with the encouragement and stuff like that. I just was curious on your position as government, because you're here speaking before government. If you were asking us to pass a mandate, and if you were asking us, as more of kind of curiosity on the vaccination thing, because I've had a lot of those kinds of questions.
Well, France just mandated face masks on any public buildings. We're a nation, I think, we're a republic, and part of the issues with that is that we have a lot of control of policies and procedures at the state and municipal level. So I don't know that mandating a vaccine would it would create a lot of resentment. There's a lot of fear about vaccines. But if we hit a point where we have about 50 to 60% of the population vaccinated, we get that herd effect to where the virus diminishes and goes away. So,
And we've seen that with measles and polio, and I mean,
correct.
I agree, but
So I think you'd have, without making it a legal requirement, which has a lot of medical legal entanglements, I think, to strongly encourage it. And I think we have a citizenry that is right now would welcome a vaccine rather than staying home again and not working.
But as a medical professional, does it scare you a little bit that they're trying to rush this vaccine through?
Well,
I mean, I understand why they're doing it, but does that make you nervous?
it doesn't, because of the they're still having 3 phases of experimenting with the vaccine to see if it affects animals and there's any side effects, if it has any obvious human side effects, and then if it has efficacy. That's phase 3, if it actually achieves what you want, which is to have immunity against the COVID-19 virus from the vaccine.
But they're even saying, even the CDC has put out things saying that the antibodies they can't even guarantee that the antibodies protect you. So that, to me,
That's
again,
true.
the science keeps changing, the information keeps
Well,
changing.
I think that's a little CYA in that it generally, antibody does protect you if you're exposed to an antigen, which is a vaccine, and you develop antibodies. The antibodies will destroy the vaccine. I don't know why this virus would be any different, but everybody's hedging their bets and they're saying, I can't promise you this, it may not. But historically, antigen stimulation of antibodies, when the antigen is similar to the virus, then they're effective in attacking the virus.
And I think it was even a CDC official that said, but their concern was mutation, I believe. And that was sort of the concern with the antibodies.
Well, that would
But we should
render-
probably continue, we're just more,
Yeah, the flu,
conversing at this time,
The
but-
flu mutates every year.
Right.
And so we get a different vaccine.
It's about 40%
So if coronavirus
effective.
mutates, they're going to have to create a different vaccine every year, which is a challenge, but it can be done. We do it with the flu.
but we're vaccinated for the flu with the prediction of what strain we think is, or strains we think are going to come. That's why it's only 40% effective.
Correct. We sample in Asia and Australia of what variations or mutations have gone around the planet are now going to be exposed to us, and we develop a vaccine based on proteins from those viral walls, and sometimes we miss. The last time we missed is the biggest strain came from Australia. Coronavirus generally, historically, doesn't mutate that much. There are about 6 coronaviruses we know. 3 are just kind of common colds, and then you have MERS and SARS. And they don't have a history of mutation like the flu does. Now, could it mutate? Yeah. But that's not its general pattern with that family of viruses.
Thank you.
Doc,
You're
I've
welcome.
got a couple follow-ups with that, and then I'll turn it over to Commissioner Pritchett. With respect to the estimate of 10 to 20,000 deaths in Brevard, I don't want to broad brush you and somehow suggest you're responsible for what other health professionals may have said. Have you at any point said we're going to have 20,000 deaths in Brevard?
No?
I didn't think so. With respect to the changing science, throughout this whole epidemic, or pardon me, throughout this whole pandemic, has anyone, any medical professional that you're aware of, with either the FDOH or the CDC, suggested in any way that masks aren't effective in reducing the transmissibility?
Could you repeat that?
Sure. I know that there have been different recommendations as to which groups should wear masks and what type of mask they ought to wear. But I don't recall there ever having been any question or suggestion from either FDOH, CDC, or otherwise suggesting that masks aren't effective in reducing the transmissibility. Do you recall anyone from any of those groups or any other prominent medical group suggesting that the masks are ineffective at reducing the transmissibility
No.
of the virus?
No.
And I apologize, I wasn't going to ask you any policy questions, but since we already went there, I might as well at this point. I was going to try to keep it to the medical questions. What's going to end up coming up later on today is a discussion regarding incentivizing compliance with this at businesses. As you're likely aware, we have over $105 million that we got from the feds in the form of CARES Act funding. And what I was looking at doing was conditioning business grants from that funding upon their compliance with a masking policy in their businesses. So it would be basically saying, you're not entitled to this money, we're still going to make it available to you, but in order to be eligible for it, you need to require masks in your place of business, and you need to post that prominently using, our designated forms that are already available at every customer accessible location. Is that something that you think would reduce the transmissibility? And I would not have asked you this, but for the discussion that came up before.
I believe that any incentive, monetary or otherwise, to have businesses support masks in their facilities or their enterprises, I think is good for all of us. They can enforce mask wearing in their own enterprises, and I think really that is probably the best way to encourage, with a little bit of leverage, mask wearing in our community to mitigate for infection transmission.
I appreciate it, sir. Commissioner Pritchett?
Well, since we're already here,
You want to just, we can keep the discussion moving and keep it on this one?
yeah, sorry I don't have any questions for you, but thank you so much for bringing information. I think you did a real good job of giving us, I think, kind of unbiased information with some of your opinion thrown in, so I appreciate that. I don't want to get into a debate on whether or not a mask works. I believe it does work. There's all this stuff with that. The debate we're getting on is mandatory mask. I don't want anybody sick, and I don't want anybody to die. And I love what Ms. Stahl said, that she said if you're sick, stay home and do all these things that you need to do to risk infections. So my question would be, as we're going through this, do we need to mandate masks? And so as I'm going through this information, I'm not a doctor, I'm not a lawyer, but I have an ability to read information and try to interpret it I heard someone say the other day that the data doesn't lie, but it certainly can be interpreted differently. And Commissioner Isnardi, you brought up some really good information about how this changes continually because we're discovering things or changes are made. So I don't know, it's very hard to get us on a path of where we should go other than looking at data, which I do. That's what I do, I run data. So I think the infection rates and the death rates do make a significant statement on this virus. And why? Because we're going to hit flu season soon, and the flu kills people too. So since people won't get vaccinated for the flu season, do what they do, are we just going to live in a mask in the United States forever? And I'm not trying to downplay the corona. It's a problem, and Ms. Stahl brought up my biggest concern. It's in the long-term care facilities. And I had a few people throw out to me, you know what, it's your fault people are dying. And, you know, let me tell you what, then it's everybody's fault. Because just as a personal note, my dad died of one of these 8 years ago in a nursing home facility. A whole bunch of people died. And as you're looking at those long-term care facilities, those people are in there pretty sick, or they're waiting to transfer over and to a better life. So, you know, those are very vulnerable populations. So we have to look at other populations as well, do the things that we need to do to prevent the high-risk populations from getting things. When we went into this, and I asked Dr. Isnardi this quite often, and they were expecting some levels going up and down. Infections are up, infections are down. This is typical of any flu virus, correct, Dr. Isnardi? So, and when we went through this discussion, the goal was not to let the upper level of the curve get above what you guys could manage as far as health care to treat people that were sick. And the crunch was flu season. You thought you'd have extra flus with this. Ergo, the president went with the 15-day to flatten the curve thing. He never thought we wouldn't have infections, but the goal was to keep it under what could be managed. So going into that is got me, you know, paying attention. So my first questions is I reach out to the health community. So I called the hospitals again yesterday, got a hold of Health First, and I said, look, guys, are we overwhelmed? And they said, no, our trend's level. And they said typically the ICU is 60%, right now it's 70%, but it's in with the fluctuation that's level for right now as far as any infection at any time at this time of year. They said the hospital's typically 60%, same thing, they're not overwhelmed with COVID. They said their testing rate was 6.9%. They're very encouraged with the treatments they're using for the critically ill people with this. I cannot say this word, Demivesor. And the plasma treatments, and they said that they're having great results with the really, really sick, high-risk people as far as them getting better. Parish, they sent me information this morning, not overwhelmed. They're at their normal capacity of what they have in the hospital. ICU, if they got one ICU bed with COVID, they have an ability to have 12 more, so they said they're pretty good too. They also stated that they think this is typical trend. Everybody's in their typical trends. And then I think about what we have going on in the community, and I've got to tell you, I know this sells papers, and I know it's an emotional thing to everybody, and Lord knows I know we're in an election season right now. My favorite meme is a little girl walked up to a doctor and says, "Doctor, how long is the COVID going to last?" And he goes, "I don't know, honey, I'm not a politician." So on these things that I'm looking at in our community, I just have to do this, Dave Berman. I'm going to call y'all out. This isn't your article, though. But the Florida Today had a headline that said, some Brevard hospitals are recruiting temporary nurses as COVID-19 cases spike. I read the paper. By the way, I've been buying the paper for over 40 years, and I'll continue to buy it. But I was really disappointed because I went into the article, and here it says, Health First says, yeah, we're hiring, but this is what we always hire. Nothing's abnormal. Parrish said the same thing. Yeah, we're doing whatever we do is normal. So we have all these headlines coming out that are just terrifying. Not that this virus, I want to downplay it. It's a virus. We need to pay attention to it. We need to do the right things to get this under control. But I think we're doing a lot of good things. So let me get back on the subject of mandating. Okay, so the death rates, and I think it's an important number. Before we mandated masks, because I'm going to go with the mandating, and let me get this information. Well, first of all, the state of Florida, the death rate is 1.4% right now. We've had 2,691,000 plus some change of negative, 360,394 positive. Death rate's 1.4. New York was 7.9% death rate. Just some data. Brevard versus Orlando. In April, before Orlando mandated masks, the death rate was 2.8%. I'm sorry, Brevard was 2.8%. Orlando was 2.45%. After the mandation of masks, Brevard death rate is at 1.64. It's gone down. Orange County fell to 1.85. Not that infections haven't gone up, but the treatment of this infection is making great strides due to our wonderful healthcare people that are learning how to treat this. So then I went to infection rate, whether or not to mandate. The infection rates with Brevard and Orlando, since they've mandated the mask, there's really not any change in the delta. It's about the same. Again, do I think people should wear masks? Mr. Berman, if you print anything else this time, please print. Commissioner Pritchett says, please wear your mask when you're in public, because you should. Now, do I enjoy the mask? No, I can't even breathe in humid situations. As Commissioner Isnardi says that, we're doing this to protect other people. It's good. They are uncomfortable. They cause all kinds of problems. And I've got to tell you, when I'm wearing it, my hands are all over my face. So I'm taking a risk for you, keeping you safe, because I'm definitely touching my face more than I used to. So should we mandate them? Again, I don't see a significant difference right now as far as mandating. And so I started having some fun with some people sending me emails that really wanted me to mandate the mask. I sent a thing back, do you want to mandate it? Vaccine, because I see the flu vaccine works, because when I get the flu shot, I don't get the flu all flu season. And I got back a very strong HE double hockey sticks, no. So nobody wants to mandate a vaccine. And to be honest with you, I don't either. Am I going to get a vaccine when it comes out? Yeah, I'm going to get the COVID vaccine. I'm going to wear my mask. So as we're going through this thing about mandating or not, I'm going to ask you to please wear your mask in high-risk situations. But if we go down this road and then we start mandating a vaccine, I just don't want to go there. Plus, if we mandate it, I'm not going to, punish people if they're out not wearing. I just can't do it. This commissioner just cannot do it. But I'm going to ask you to please wear your mask. And if you don't, you're the one taking the risk, and also the people wear these little masks with the little ventilators in it. They're blowing their bacteria out all over everybody. So, we don't do it right either. But please wear your mask. And let me throw this out. If we've had all these people right now with the COVID, and they said it's times 10, and most of these are the young people, we've probably had over 30,000 people in this community that have got through the COVID. I'm going to make a plea to them right now to go donate this plasma, because the plasma's working. And maybe if you don't even know if you've had it, go get it. I know the antibodies aren't that good, but get the test. Maybe you could go donate some blood, because then you can find out. Maybe we can do something to get this death rate down to almost zero. And then this can fall in the same category as the flu as we move forward. And that's the place we want to go. But I would love to start hearing some good news put out in the paper and the media. Like we have, like you said, sir, we have treatments coming. They're starting to work. Maybe get some of the fear aspect off of this. Please be wise and be careful. But we need to get a little bit of common sense. You cannot mandate that people do the right things. You cannot mandate personal responsibility, but I'm going to make a plea that we just do it.
A couple thoughts on that. First, with respect to the Orlando analogy, I do want to point out that when they put that mandate in place, it wasn't really a mandate because there's no enforcement. So if you really want to compare the efficacy, you need to look for a similar county, similar population density that actually has teeth in the enforcement. So percentages for, thanks. Percentages for?
Overall infection rates and death rates, so if you take a data source of both parts, you get a percentage, which the statistics are pretty accurate.
The concern that I have is you're looking at a county for comparison purposes that didn't have any enforcement mechanism whatsoever and saying because our numbers trended in the same direction. I don't know that that's untrue. It may well be perfectly accurate that therefore the mandate isn't effective. It may not be as effective if there's no enforcement mechanism, which I believe Dr. McPherson mentioned earlier.
Or perhaps that our communities wearing masks is responsibility, as Orlando is, although we're not mandating. That's another hypothesis.
And that's potentially correct. There's so many variables. If you can't really get an apples-to-apples comparison, I don't know what good it does us. And I've heard at this point a couple different commissioners mention mandatory vaccines. I don't think anyone has suggested here or elsewhere mandating COVID vaccines. There's a huge difference in my mind between puncturing someone with a piece of steel and injecting something where they could actually have some sort of an anaphylactic reaction to it, even if it's infinitesimally small in terms of the percentage that has that, where that's really designed to protect them more than protect others, versus putting a piece of cloth over their face, not puncturing them, not causing them to bleed, and not injecting them with a foreign substance where it's perhaps inconvenient or slightly uncomfortable. As far as not being able to mandate people do the right thing, the state mandated a long while back that we can't smoke in restaurants. They didn't do that to help the smokers out. They did that to help the population out that otherwise would be getting that secondhand smoke. I can tell you, I think that was a good thing. Is it a regulation on business? Sure, but it's a smart regulation that, quite frankly, will have saved lives in the long run, because less people are getting all of the different carcinogens in their lungs that they aren't getting the enjoyment out of smoking to begin with. So, I don't want to poke holes in everything that's being said, but my concern is we're talking mandate. I tried that route before; it didn't work, and at this point, I'm looking at an incentive-based option, not a mandate, where we say, look, as Commissioner Tobias correctly stated before, there is no entitlement to CARES funding. If we said, heck with you guys, we're sending everything back to D.C., aside from making Commissioner Tobias' day, there wouldn't be a cause of action from these businesses to turn around and sue us and say, you gave our money away. It's not theirs. It's not theirs. It's simply not theirs. It's not something that they have any legal right to. If we, as a condition of giving them something that they're not entitled to, say you have to have a mask policy, that's not a mandate. They don't have to have a mask policy. They don't have to take the money that they're not entitled to. So to me, it seems to be a way to strongly encourage compliance, because there's money on the end of that, without telling people they have to do one thing or another. It just seems to be the most light-handed way of at least taking a measured step toward the goal of anything I've come across. Commissioner Tobias, you have a light, sir.
Thank you, Mr. Chair. First of all, Dr. McPherson, thank you for being here. I don't think any of us have the ability to complain about having to wait for a doctor anytime soon, so thank you for your patience. Second of all, Mr. Chair, that was the Florida Clean Air Act. That was actually not a mandate because it was a voter approved, so voters made that, what I would say, unwise decision. And third, and this is completely at your discretion, of course, as chair, but it seems like we have crossed the threshold of what may be a proposal coming out of your office, with the memos that we received, and I imagine that would come later in the agenda. But since we have experts here,
Sure.
I'd go with you either way. But if you want to bring this up
You
again, and whatever you want, I'm just saying we're pretty darn close to
You're right.
your proposal. So
You're right, and we do have one public comment card, quite frankly. I don't know if it's going to be in favor or opposed, but why don't we hear from that individual, and we'll...
it's your show.
Yeah, let's do that. All right, we have, and I'm going to move, this was a comment card on L as in Lima 4 from Tom Unrath from Melbourne. So I want to give him his 3 minutes before we go any further. And why don't, just for clerk's purposes, why don't we just consider this all L4? This will be my board report. Come on down, sir. And Doc, I don't know if you have time, if you want to grab a seat. Sure. Take your pick of the litter there, as long as you're 6 feet away from folks. Mr. Unrath. Thank you, sir.
Tom is easier.
That'll work, Tom. All right, you've got the floor, sir.
I'm Tom Unrath, 1170 Ida Way, Melbourne. If this were, in fact, a discussion about mandating masks, I would encourage that. It isn't, but a report in the paper yesterday, day before, indicated that Georgia Tech has a program now that county by county across the United States will help people to understand just exactly how widespread is the coronavirus. Even though tests right now would indicate somewhere around 4,300 here in the county, according to what they said, it would be more like 43,000 people that don't even know they have the virus. And so it's a lot more widespread, I think, than a lot of people are giving it credit for. And if you're talking about getting businesses on board with wearing masks, I think that's a very, very good thing. And if y'all were to say, y'all need to do this, then what you're doing, in fact, is kind of taking the onus off of them, kind of giving them some cover. And if somebody comes into a business and says, no, I'm not going to wear a mask, the business owner can say, yeah, you are, because the commission has said that you should. And there you have it. Commissioner Smith yesterday, I think, was in the paper saying that you can't cure stupid. And, you know, I get that. But you can cure ignorance. And so by putting out how dangerous this virus is, how widespread it is, can, again, help to cure ignorance and get people to pay a little bit more attention. Folks have said that you're taking my rights away and so on and so forth. The Declaration of Independence talks about life, liberty, and the pursuit of happiness. You can't have liberty and a pursuit of happiness without life. And as you have said several times, we're talking about saving lives. And I think that's really what this gets down to. Having had the coronavirus myself, I can tell you that wearing a mask is nothing compared to that experience. And I would wish to prevent others from having that experience. And in today's paper, you're quoted as saying, Commissioner Lober, while only a small percentage of the overall population has died due to this virus, any avoidable death is one too many. And that is absolutely the case, and I would really encourage you all to put as much teeth into this as you possibly can. Thank you.
I appreciate it, sir. Thank you, sir. All right, so for the folks that aren't necessarily on board with what the proposal was that was circulated before, essentially what I'd like to do is the CARES app, the CARES funding application that's slated to go out next week from the county could be modified so that it still goes out next week from the county with an additional self-certification box where they essentially check saying, we've posted a county-provided placard, and we voted on this and made them available with our strong recommendation, resolution, or proclamation that we did a meeting or two ago. We posted a placard provided by the county indicating that masks are mandated inside this establishment. We will maintain that placard at all customer accessible entrances until the local state of emergency subsides or until further action of the commission. That way you have an end date in sight, and it could be a month, could be 3 months. Really don't know at this point, but we still have control over it. We can revisit it whenever anyone wants to revisit it. But essentially, in terms of the exceptions, I don't think we need to get into whether it's someone over 75 or someone under 6 years old or someone that's got an ADA issue or someone that has, let's say, they're on supplemental oxygen. The bottom line is we need to have something that's broad enough that the average person walking in understands they really need to be wearing a mask in those establishments. The downside is, with respect to this, and I have been opposed to criminal enforcement broadly with respect to anything mandating masks or suggesting masks. I just don't think that's the way to go about it for a variety of reasons. Even when I brought up the prior proposal, which got shot down 3 weeks ago or so now, I was talking about having the first violation be a warning and the subsequent violations all being a $50 fine. I think West Melbourne, and I spoke with Deputy Mayor John Ditmore yesterday, put in place a tiered fine structure where it starts with a warning and it goes all the way up to $500. And what I understand from having spoken with him yesterday, and I apologize if any of this is at all inaccurate, but I promise it conveys the gist of it, that even after they put in place a mandate at a number of their stores, over 80% of the folks that were polled by the city indicated they were happy having it in place. That's having a mandate. What we're talking about now is something that's far more hands-off. This really gives the businesses the opportunity to make the decision for themselves, and if they don't want to do it, they don't have to do it. So to me, this is the most hands-off way to accomplish it. If there is a complaint that a business is not posting it and that they receive CARES Act, and frankly, I don't think we're going to get complaints because someone would have to know that they received CARES Act funding. They would have to go by and see that they don't have something posted. we could look into it, not having BCSO, but having county staff look into it, whether it's Ian's department or whether it's Tad's department, to take a look at it, see whether or not it's posted, and then use discretion in terms of whether to give them a warning and tell them to put it back up, or immediately, which I would suggest we ought to do instead, simply tell them they're obligated to reimburse the county for the funding that we've given them that we were never obligated to give them in the beginning. So that's essentially where I'm at, to require a self-certification for those folks that are applying for CARES Act funding on behalf of businesses. This has nothing to do with the individual direct relief, where they're saying we have up the placard that's provided by the county. It's already available, and we're going to maintain it until the local state of emergency subsides, or alternatively until we're told we don't have to maintain it by the commission. If there's a failure to adhere to that, staff would look into it. I don't think we're going to have hardly any, if any, failures to adhere. And if they didn't adhere, they're on the hook for paying back the county. That's the proposal, essentially. Commissioner Tobias, you've got a light, sir.
Thank you, Mr. Chair. And I think you pulled the proverbial rabbit out of a hat on this one. You took a losing hand and I think turned it into a very competitive one.
I hope.
I agree that the condition of emergency funding on steps being taken to alleviate that emergency is in fact appropriate. As you mentioned, this would represent a choice to businesses, and it is not a heavy-handed mandate, which is where my issue was. To make me a little bit more comfortable with this, I think I'd like some assurances that Mr. Berman put in the paper, so they shouldn't be surprises to anyone. There was a question of the nonprofits. Ms. Bentley mentioned that, so maybe we can get another thing in here. I'd like the nonprofits limited to 501c3s and 501c19s. Those are tax-exempt organizations, and what makes them different from the other ones, they're not allowed to employ lobbyists. So if we did this, this would keep the CARES Act out of the hands directly or indirectly from lobbyists. Second, is important that we express condition to be added that no business organization has an outstanding tax in their arrears. I don't want this money to go to businesses to turn around and then pay fines, whether that is, again, directly or the money is shifted around. And finally, and this is most importantly, I would ask that the motion include that the board's intent that this represents the final portion of this program. In other words, the board will not increase the funding and limit it to $10 million. While I was not in favor of this amount, if this is where it ends, it is something that I could vote affirmatively for, being a given amount, as well as having the mask as a condition. So I would ask for those three, and with those three, I would certainly support your proposal, Mr. Chair.
Here's what I can tell you. I think your first two are probably not going to be tremendously controversial. Your second one, if someone opposes, I can't imagine why. I agree. If they, and I'll have, the proposal certainly will contemplate that they can't have taxes in arrears. If you want to go a step further and say they can't have code enforcement fines that are outstanding, I'm fine with that too.
I thought we already did that one, Mr. Chair.
Did we? Okay, all right, we did. You're right. I'm sorry. Okay, so we've already got that. Yeah, I'm fine with that. As far as nonprofits, to me, that's a small step to encourage people to mask. If that's what it takes to get you on board, I'm fine with that. But the concern that I have, frankly, it doesn't matter what I think about limiting it to the 10 million, because I don't know that that's going to pass with the rest of the board. I'm happy to go either way with that. But I would want to clarify that limiting it to 10 million doesn't mean that we can't use any of the other CARES Act funding. It just means that we can't increase that pot with those existing conditions to the 10 million that was allocated. That I could live with. But again, I don't want to say yes and then alienate a majority of the board.
Mr. Chair, my 10 million would be for the pot of businesses and the nonprofits listed. If Mr. Golden came back and said that the 4 million that we allocated in direct food subsistence wasn't enough and we had a greater need as the pandemic went on, I would have no problem voting for food subsistence. I don't think it's right that money go to businesses. It's been mentioned here that we want to get the money to the people, and I think filtering it through the business is the wrong way. However, if it is capped at $10 million for businesses and nonprofits for that as a category, we can debate the other 90+ million, or I guess what the other outstanding 70 million later, as long as this is just taken off the table, Mr. Chair.
Yeah, let's see where they're at, because to me, I mean, the most important thing in my mind is to get a policy in place where we strongly encourage masking. You know, I'm flexible. I really don't want to limit it, but if that's what it takes, that's what it takes. Mr. Abate and then Commissioner Pritchett. It says Abate. Oh, is that
Yeah, no, that was
Commissioner
the
Smith?
Commissioner.
I'm sorry, sir. All right, is it like a hyphenated last name, Smith Abate?
Yes, that's it.
All right, go for it, sir.
All right. I will be opposing this. I don't think it's a good idea. I think small businesses, being the backbone of our economy, they shouldn't be penalized. Leave wearing masks up to them. They're in business. Business is all about competition. If they feel like they best serve the community by requiring masks, then they'll require masks. If they think it has no effect on their business, they won't. They're sensitive to the public. They're very sensitive to the public. If not, they don't stay in business. That's what they do. So I think penalizing businesses that need help would be big government at its worst, and I will not support this.
All right, Commissioner Pritchett.
I just want to start with Commissioner Lober. I totally respect you and your passion on this, and it's what you believe, and you have my utmost respect on it. I really believe with all my heart you're doing what's really right in your heart, and I just got to tell you, I really respect that. On this, this is stimulus funds again, and the federal government isn't putting all these stipulations on that. Let me throw this out to you. If anybody in here has gotten the PPP or the small business stuff, you barely had to fill out an application. They didn't verify anything. They're trying to get the money into the community. Why? Because nobody's working. So what we need to do, because they start giving it to the governments to help disperse it on places they were missing, and Commissioner Isnardi nailed this a little while ago, and she really got me thinking. We got to get this money into the community as quick as possible because people need it. And if they don't need it now, come October, November, we're going to be seeing a big crunch economically on this. Just watching it and knowing it's coming. If Ian needs more money, I'm for it or whatever we need to do, but we need to get this money out. We've got a limited period of time to get this out. With small businesses, we've got a framework ready, and Commissioner Lober, if you want to do like instead of that, $1,000 bonus to all the ones that hand out masks at their doors for everybody going in, I am in on that. I think that's a great incentive. But as far as this, if businesses want to mandate masks in their stores, you have my complete support. I'm for you. I will fight for your right to do that. So if that's what you want to do it. But I just don't feel like we should withhold stimulus funds, which has just been given us to get out so that the community can have some money and get our economy up and moving. Because I think we're about to see a problem here soon. So I'm probably not going to support this either, except Commissioner Lober, if you want to do a bonus amount instead to all of the businesses that will have the mask and hand them out at the door, I am in for that one, sir.
It's interesting. My thoughts, I guess, just to kind of start back chronologically here, as far as penalizing businesses, if we were hitting them with some kind of a fine, certainly it would be penalization, but it's by definition an incentive when we're saying we will give you something that you're not entitled to if you comply with these criteria. We've already taken the step of putting in criteria that they have to comply with. So no more, it's no more penalizing than any of the criteria we put in place that they have to meet
I know,
anyway.
but the federal government gave everybody money too without, there was no penalty on it. So these are federal funds.
Sure.
So along the same personality of nature of that, I think that's consistent with it. But again, I really love your heart more than you know. I do. I think you have a great heart, and I get it because it's what you really believe. But you would win me if you want to do a little bonus for the ones that will do that as an incentive. But I don't think I can vote for the other.
If there's some way that we could figure out how to incorporate a bonus, I don't necessarily have anything in opposition to that. I think that makes some sense. I would point out, regardless of what we do, though, certainly with what's been proposed thus far, there's not going to be any delay in terms of getting it out. It's not, because I know you mentioned that you want to get it distributed as quickly as possible. I agree with that. I think that's a good goal. But I talked with Jim Liesenfeld yesterday. I know he talked with Kathy Wall, and forgive me for speaking out of line if this is at all less than 100%, but my understanding is it's an easy change for them to add a self-certification. So as far as the delay concern, I would put that to the side. I just don't know, thinking off the cuff here, how we would go about implementing a $1,000 bonus to businesses that hand it out, because the problem is that the conditions federally on handing out the money require that there be certain, basically mandates which expenses are reimbursable and which are not by extension. And I don't know if they hand something out, if we can therefore legally give them the money. Ms. Bentley, do you know that if there's any way to do that?
They would absolutely have to meet the federal criteria. It may be that if there is a point where there's not enough money for everyone, you could weight those applications more heavily or something like that. But just a pure bonus without COVID-related expenses, that wouldn't work.
Yeah, so maybe it's something to work through in the future when we look at re-upping, if that's the way that we go.
Okay.
And I would be open to it. I want to make sure that if we do it, we're not going to be on the hook to pay it back out of county funds or county general funds.
Spoken like a lawyer.
But, all right, so we've heard from the right half of the room. Commissioner Isnardi, I'm going to call on you.
And I don't like being in this position at all, but I mean, even initially, I get your intent, but there's no way I could support this. I think that it, again, puts us in the middle of that stimulus funds, and I think Commissioner Pritchett brought that up, and I think it just adds another burden. I think people who don't want to shop places that masks aren't mandated won't shop there, people who are worried about their health. And once again, we're in that position of trying to force people to do something that they may not be equipped to do. They're just trying to keep their doors open. So I'm not comfortable with any of this. I don't think it's our place to step in. And the bonus thing scares me even more, because that's saying, way to go, for enforcing something that we think you should do, but we're not enforcing ourselves as a county. So I'm not comfortable with this at all. I think it's punishing them. And I definitely, without knowing the need of the small businesses, I definitely had no interest in capping had this item passed. So I won't be supporting it. So I don't know where we go from here.
Well, without the cap, would you be interested in supporting it?
No, I'm not comfortable with it tied to, you can get small business help only if you force your customers to wear masks. I don't like that at all. I don't think that that's our place. I mean, they're a private business. It's not our goal to tell them how to run their private business. I mean, again, and I really appreciated Commissioner Pritchett's impassioned statement on masks. I mean, I wear a mask everywhere I go. But I don't think it's our role to dictate that other people should have to. I think everybody should use their own common sense and discretion.
Oh,
So-
I agree. We shouldn't.
And I think,
dictate.
again, we're just trying to grasp. We're trying to find something to put in place so we feel good. And I think what we should continue to do what we're doing, keep encouraging people to wear a mask, encourage them to socially distance. But let's not put another thing in place that could potentially impact our economy. I just won't do it.
Well, let me ask another question about impacting the economy. Since we had that measure of mine fail 3 weeks ago, we certainly didn't trample on businesses. We certainly were very hands-off with respect to them. We didn't require that businesses mandate their customers wear masks. What about those businesses that now have had to shut, that have had to close their doors because their employees have been getting sick? Well, we did right by them. We didn't make them wear masks, but now they're closed.
But it's still that business that made that decision, that made that critical decision not to require their employees. So shame on that business that allowed them to have close contact with the public or put in situations to get sick or to not have a backup plan or to, we can't be held responsible for bad judgment on their business decisions. We just can't.
They certainly, I can't imagine they would have been fired had they worn masks. They're adults, they can wear masks if they want. So put the onus where it belongs. The people that should or shouldn't wear them, it's up to the people.
Well, we've seen that there's a large percentage of the population that won't do the right thing. I mean, we've seen that with the numbers here spiking. So we can keep the onus with them, and the numbers are going to either stay where they're at or potentially get worse.
Or
They're certainly going to be worse than the
Maybe the
alternative.
stupid people will wise up and start wearing masks.
Maybe. Commissioner Tobias.
Thank you. I think there's one thing we need to understand. These are private businesses, but the money they're asking for is public money. So I support private businesses to make decisions that they want, and they're welcome to not offer masks or choose to mask. And if they do that, they can continue to operate under the structure that Commissioner Lober has said. We do this with the federal government does this with unemployment. We just don't hand out unemployment checks. We say that, hey, you got to go look for another job if you're going to receive unemployment. It's just a condition of that. We allow you out on probation. as long as you don't commit another crime. You don't have to be let out on probation. You don't have to get unemployment. But if you want to receive a public good, then you have to play by the rules. Listen, I would love, or better yet, Billy Prasad in my office would love to take his car at 150 miles down the road. But in order to use the road, he's got to obey by the limits. Now, he can go, or I can go rent a track and drive as fast as we want on a track, but just understand that these are private businesses, and I greatly respect that they can have the ability to do what they want. But now they're coming with their hands out. They are asking not for your money, not for my money, but our grandkids' money. And for Commissioner Lober to say, hey, listen, if you want to do that, maybe we should take proactive steps in order to solve what's causing this. I don't think it's unreasonable. No one is forcing. All these businesses and these charities would have the opportunity to say, you know what, as Commissioner Smith said, hey, it's in our best interest to not accept the up to $10,000 and allow masks. And if they made that decision, I may think it's the wrong decision, but I respect them, their decision as a private business owner to make that decision. But it's completely false to say, hey, listen, we want to get this money out as fast as possible, yet we're going to filter it through businesses. I mean, even the federal government, even President Trump realized that, hey, the fastest way to do this is we go hand $1,200 out to everyone, or as long as you earn below. And heck, I think even Orange County did that when they set up an online portal where people could go get money. Again, I think this is absolutely wrong, but it's false to say, hey, we want to get this money out and then filter it through businesses. There's just, those two statements aren't congruent. I'm going to support you on this, Commissioner Lober, because again, and many times I fight hard and lose and don't come back, and you came back and more towards the middle. I greatly appreciate that, your persistence on this, and I made a promise to my sister-in-law, who keeps on telling me to mandate masks. There is a compromise here, and I didn't find it, but you did.
Is your sister-in-law the one that's married to the physician?
Yes.
Okay.
Who also did a residency at the University of Pittsburgh, McGee
Number
Women's
14
Hospital.
nationally.
Yes.
All right, and this isn't something I'm asking anyone to support because it's important to me or important to yourselves. I mean, this is really something for the county here. And I would just say Commissioner Tobias summed up my stance perfectly in that I can't really add to it. But I apologize, we have a couple more lights. Commissioner Pritchett?
Yeah, just real quick. In a normal universe, Commissioner Tobias, I completely agree with you. This has not been normal. Like you said, the stimulus funds, all the money coming out and floating around. So if this would have been a year ago, I think we'd have to do things differently, but we're not at that place. And again, there's so much money being printed and handed out. I have great concerns of our economy after this. The president seems confident that he's going to be able to turn it around. Maybe he will, but when we lived through the housing and banking crisis, it was a long road back. So I think we got some situations coming up soon. And in a normal universe, yes, we would do it, but I think these funds have a totally different personality to them. And so, Commissioner Lober, when you're ready to vote, I'm ready.
All right, well, it sounds like there's not necessarily a point, Commissioner Tobias, based on where everyone's at, even to make a motion. Unless you want to have everyone on the record as being in their position, which is fine by me too.
Is my button working?
Oh, Commissioner Znardi.
Okay. I pressed it a couple times. I wasn't sure if it just was
Press
missed.
it again, I want to see. You're showing up now. Yep,
Okay.
go for it.
I just want to say that, this money came from the federal government, but it came to us with a packet of rules. How thick, Frank? An inch thick of rules we had to abide by to use those funds. So us putting in additional rules just because we want to say you're worthy of it or you're not is not our place. So I'm not going to justify my my vote against this any more, I think, than I already have, because it's like beating a dead horse. But I think that, again, I think punishing small businesses, giving them additional things to do when they're just trying to keep their doors open is not a fair thing to do. And I won't support it. I'm sorry.
I just, the last thing I'd add to that is if you don't think it's our place to add conditions to the federal money, then we shouldn't cap it at 50 employees. We shouldn't cap it at 10,000. Why not open it up to folks with 1,000 employees that really don't need the money? And why not make it $1 million or $10 million per business? I mean, we've already put conditions in place. And if you're going to vote against it, that's fine. But it should be for a legitimate reason, not because we don't want to put conditions on when that's exactly what we've done.
Well, we may have put conditions on as far as, the amount of employees, but we're not giving them additional steps that they have to go through. So again, like I said, I wouldn't have capped it at 10 million, not because I thought businesses necessarily would need more than everybody else. Hell, I was the first commissioner that was pushing so hard to get the money out to the people that were without jobs and that were impacted the most. But this money was designed to help businesses impacted by COVID. It wasn't designed to say, we're going to help you out, however, but we want to make sure that you're doing X, Y, and Z when it's not even a law that we put in place ourselves. This commission voted not to, or I should say, this commission didn't vote to move forward with passing our own ordinance, but we're going to expect them as a private business to do it. So again, speeding a dead horse, I could talk for another 15 straight minutes and we could go back and forth, but it's pretty pointless at this point unless you've got 3 votes. Let's move.
Commissioner Pritchett? Okay. Well, Commissioner Tobias, I don't think it's going to go anywhere today. I think it's pretty obvious. So unless you want to get folks on record as being in a particular position, I'm going to let it be.
I do want to go on the record and say thank you very much for attempting to find a common middle ground. I think you did a very good job. Clearly a lot of work came out of your office on this, and I hope this doesn't get worse. I pray this doesn't get worse. But maybe if it does, instead of jumping directly to a mandate, maybe we could start here and see where it goes. Again, thank you for taking the time and the effort to put this in. I'm sorry it didn't move forward.
No, I appreciate your flexibility as well. Frankly, the first couple ideas you had, even though I wasn't thrilled with the third, they're good ideas. So, your input certainly is appreciated. All right, we'll move on from there. J2, I believe we left at. Peter, I'm sorry. Do you want me to kind of give them just the teaser in terms of where I'm at with it? So I don't know what he's going to recommend at the end or if he's just going to give us a bunch of options, but at the end of the day, I'm going to suggest that we leave $1.25 million available so that they can redo the walkways and the restrooms in Lori Wilson. They really need it. The remainder of it, given the financial circumstances, if it has to be taken off the table for now, I'm not thrilled with it, but I think we all need to play ball with our individual districts. This is one in my district. I don't like it. But I think the rest of it can wait. I don't think the walkways can. We had someone get injured in the recent past because their foot went through the walkway. That's going to happen again if we don't do something, or alternatively, we'll just keep blocking off the walkways, which I think is bad too. And the restrooms, obviously, those are the two things. I think $1.25 million, given the size of the park, and it's humongous, and the lengths and widths of the walkways, that'd probably do it. Peter?
Yes, sir. The only other thing is we need, for the RFQ that was issued last year, we just need the board to reject that since that's sort of out of date now. So if the board does accept your proposal for the $1.25 million to be used for repairs, that won't require us to do another RFQ because we have contracts in place that we can use to accomplish that.
Okay, so before we get too much further, and I don't believe, no, we don't have any speaker cards on this. Let's address the first item of business. Can I have a motion to reject all of the bids that came in? So moved. All right, a motion from Commissioner Tobias. I'll go ahead and second it. All in favor of rejecting all the bids that came in, say aye. 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 Any opposed? Passes unanimously. Okay, and I see a couple new lights from Commissioners Tobias and Pritchett. Are those new ones? All right, perfect. Peter, if you want to continue with the rest of it in terms of the repairs, just to bring them on board, and if you don't want to hear it, I'll save him the time as well, but otherwise, if you want to start up.
Sure. Yeah, I think the bottom line of this is the TDC was recommending sort of holding on spending due to the reduction of TDT tax collection. So That being said, as you mentioned, there are definitely repairs that need to be made. Of course, we also need to maintain the park, so there are some expenditures, but they're recommending we hold on the $5 million project, which was a bigger refurbishment project of the park, and they're also recommending holding on any IRL grants for next year. Which typically we would have $1 million in the budget for that, but again, with our reduction in expenses, they're trying to be prudent and make sure that we're able to adhere to the contract that we have with the Army Corps. So that's what's driving that.
And my thought on that too, if it's all right, Commissioners, just with respect to the other, let's, if you don't mind, kind of bifurcate this and deal with Lori Wilson on one hand and the IRL on the other. Because I have a different position with respect to those two, and I may well be on the same page with you on one and not the other. Commissioner Tobias?
Thank you, Mr. Chair. If we're going to bifurcate, which one are we going to start with? Lori Wilson?
Your pick.
Okay, I'll start with the Lori Wilson one. Commissioner Pritchett said that this budget is going to be tight. Not this one, but the following one. And we have to make priorities. And we have to make that apparent in our budget. And there are some opportunities, I think, where we can make some cuts without decreasing services. And I think parks is somewhere. It's something my office, as well as the parks director, under our direction, has been looking at. Palm Bay, a little while ago, the county had some parks wholly within Palm Bay, and Palm Bay decided that it was in their best interest to manage the parks that were within the jurisdiction of Palm Bay. There are a number of parks that are wholly within the jurisdiction of a city. Now, there are some other issues when it comes to parks MSTUs, but this is why it's not as simple of an issue. But there are interlocal agreements that can be entered into where we turn over these county parks over to the city, no loss, and the cities can make a determination as to move forward. So I'm going to support you in this one because I like to see that I love throwing his name out there. This was a Commissioner Barfield idea that I thought was pretty poor to begin with, but the more I wrap my head around it, I wish it was expanded. I wish we could take TDC dollars, and I wish there were more of them, and use the parks that are within the county. There are a number of beach parks in my district, the south end of the county, that meet the definition, so we could use TDC dollars. If there were more TDC dollars, this is a way that we could keep levels of service at where they are while reducing general fund. So what I'm saying here is something will be coming out of my office in the short term as to look at the possibilities based on current interlocal agreements, as well as whether the cities even want, hopefully, these parks. But I'm going to support you here, but I would ask that you keep an open mind as we move forward to take some of county parks that are fully encumbered within a city and looking at whether or not the city should have the responsibility to take care of those instead of us.
I'm good with that. I can tell you I've spoken with the mayor and the city manager out there specifically about transferring this park. One of the concerns, and you may want to talk to some of your constituents to determine what their thoughts are on it, that comes up is what the cities are going to do with respect to parking and how they intend to monetize that. Because turning over a county asset that's prime real estate, even if it's being maintained as a park, even if we have an obligation to maintain it as a park, I have a little bit of unease taking something that's totally accessible where people can freely park there, handing it over to a city, and the city saying, well, why should we take it if we can't monetize it? So it's something to consider. I'm not saying that there aren't circumstances under which parking should be charged for, but if that is something that happens with this park or another park, I would like to see the money they make from monetizing the parking go right back into that park as opposed to being a cash cow for the city.
And I thank you, Mr. Chair. You bring up the exact same issues that I have with CRAs. Cocoa Beach used CRA money, 45% or better, that was from from county taxpayers, built a garage, and now is using that as a cash cow. So in effect, these people are not only paying for the garage, they're then paying to park. So I completely understand that. That is something that, with an interlocal agreement, we could make sure that it's a park. And if the city decided to go in the direction of monetized parking, that it would be used to maintain or even better that park. So I agree those are things that could be definitely hashed out.
I'll keep an open mind, sir.
Thank you.
Commissioner Pritchett?
Yes, sir. I was going to kind of ask the same thing, because what we're in right now with the unsure economic future, that I thought we should kind of put a hold on things till we figure it out. And I agree also that I think we need to do repairs in Lori Wilson Park, because it's a county park, and it does have some need issues. So I think, up to the amount that Commissioner Lober said, whatever it takes to get those repairs done and to make it safe, it would be good. As far as turning that one over for what we just learned with the ability of keeping some parks open or closed, I'm not real sure that I'm going to agree to relinquishing Lori Wilson Park at this any time of my sitting up here, unless something really happens that changes my mind. So I think it became a very important park over a period of time. So Commissioner Lober, I'm going to be in agreement with you on this. I think it's a wise move right now, because we don't know what we have ahead of us.
All right, Commissioner Tobias, in that case, I'll kind of pick you out as the victim here. Would you mind making a motion to make available $1.25 million from the TDT to perform repairs in Lori Wilson, up to $1.25 million from the TDT, and then we'll reduce the amount that was allocated from 5 to, by an amount of $3.75 million to that $1.25 million at this point? All right, I'll go ahead and second that motion. Does that contemplate everything you need?
Yes, sir.
All right, perfect. All in favor, say aye. Aye. Any opposed? Okay, passes unanimously. Now, here's the one I'm real skittish about, the IRL grants. And I know that Peter put in, I think it was in the agenda report, unless we discussed it. We've got a couple different options. We can cut it to nothing for a year. We can cut it in half. We can do whatever else we want with it. We can leave it where it is. I really don't like cutting it. I can tell you right now, I'm not going to support cutting it to zero, even if it is a lean year. I think it's important enough that we need to keep something going there. I don't want to set a precedent where we're just hammering that as the first go-to. Commissioner Pritchett.
Is it possible that we just kind of put it on hold for 6 months and we have this discussion again in 6 months as far as grants? I think that would be some wisdom.
We could do that.
I'm happier with that, to be quite honest. Commissioner Tobias?
Thank you. My understanding is we're trying to decrease expenditures, so we have the ability for the matching grants for the dune repair. Was that
Correct. Yes, sir.
okay? So if we were to put a moratorium on doing anything or to keep the spending, where would you make cuts? Because obviously you can't create more tourists. In this, where would you make cuts, and so we can have that matching? That, help me here, is what, 7 or 8 or 9 to 1? I mean, it's a huge return.
Yeah, it usually comes out to about 9 to 1.
Okay.
I think, in that fund, we have carry forward funds, so we're okay for right now. We just did a big project in the mid-reach and the south reach. So we don't think Army Corps will be coming back for any major expenditures in the next 12 months. Obviously, when we look at the 50-year plan, we've got to have funds in the future, and if we keep spending at the current level, we would not have that. But for 1 year, I think we're okay. If we hold for 6 months or, have another discussion, we can see where we are.
And in the off chance they did come back in 12 months, I assume you'd be lobbying for it, especially if there's a 9 to 1 match. Where would those funds come from?
Again, we have some carry forward funds. That's
enough to cover that?
We would, yes, sir.
Okay.
Yeah.
Thank you.
All right, I don't know that we need a motion for that unless there's something you'd like us to have in the form of a motion.
For a delay of 6 months, yes, sir, that would be helpful.
All right, can I have a motion to, we'll continue it out for 6 months?
To continue it out for 6 months.
And then we'll let Mr. Kranis figure out which meeting he wants to put it on, roughly around the 6-month mark. Fair enough? All right, I'll go ahead and second Commissioner Pritchett's motion to kick this out for 6 months. All in favor, say aye.
Aye.
Aye. Any opposed? Passes unanimously.
Thank you.
Thank you, sir. All right, now we get into the interesting stuff, huh? All right, J3, Commissioner Tobias, it's your show.
Thank you, Mr. Chair. This is a request, permission to advertise an ordinance, one that I mentioned last week. I threw out some options, and there seemed to be some general support, so I limited this so we would have the opportunity to advertise. I wanted to, before we got into this, discuss some of the very good points that some of my fellow commissioners made, some, in fact, that I did not have good answers for. So the first one brought up was the difference between an offender and a predator. This section of the ordinance we're talking about amends Section 74-102B already expressly applies to both offenders and predators, and for good reason. According to FDLE, there are 771 sexual offenders released in Brevard County, 96 predators, for a grand total of 867. Some examples of crimes which would require registration as an offender but not a predator. Transmission of child porn under Florida Statute 847.0137. Knowingly selling obscene material to a minor, Florida Statute 847.0133. Transmission of obscene material to a minor, 847.0138. Sexual misconduct when the victim is in a facility for the disabled, 893.135. We brought, Commissioner Smith mentioned something about an age, and this is something the legislature has dealt with on a number of occasions. I just didn't have the specifics. It's Romeo and Juliet, and what that did under Section 943.04354, it creates a system for which people who were convicted in these scenarios to be removed from the registry. In fact, an offender who has sexual relations 18 years old with a 14-year-old can be removed from the registry because there was a 4-year age difference. As such, the individuals that Commissioner Smith mentioned, the 18-year-old and the one that was a girlfriend that was a few weeks shy of 16 and they later got engaged, would be able to be removed from the registry. Thus, this would not impact them. So what is the proposal? Basically, this would allow businesses to close the loophole that currently exists in our code because now it only applies to publicly owned parks. This would create a voluntary registry for businesses. The businesses would be required to certify that it is a place where children regularly congregate and the primary purpose of its business is recreation. These requirements are based on state statute definition of parks and its sexual offender definitions. Some examples, and I just looked online, might be Andretti Thrill Park, Chuck E. Cheese, if it makes it through this, Urban Air Trampoline and Adventure Park, or Sky Zone. The registration would be valid for 1 year. Based on the experience with creating a registry for animal abusers, the cost would be minimal. The ordinance would not place any liability on the business to enforce. The penalty for violation would be the same that currently exists for public parks, Section 74-103, up to $500 fine, 60 days in jail. More importantly, if the violator represents a violation of conditional use, this offense may be used for reincarceration. I would like to thank Sheriff Ivey for working with me and supporting the concept as we move forward. Now, this fully has not been vetted. There are some issues that I think can be worked out, but that's what the purpose of advertising. So I'm more than willing to answer any questions, but I'm also like to make a motion when it's all done for legislative intent and permission to advertise the ordinance as indicated in the agenda report, Mr. Chair.
All right, first we'll hear from Commissioner Smith, then Pritchett, then I'll jump in.
Thank you, Mr. Chair. I just have one quick question for Commissioner Tobias. Is there or was there a particular instance that occurred causing you to instigate this measure?
Mr.
Please.
Chair.
Yeah, please.
Yes, I have not a constituent in my district, but a constituent in Commissioner Pritchett's district, who constantly contacts my office that Brevard County is too strict on sexual offenders. Brevard County goes above and beyond what the limits of the state are, and he thought that that was too harsh. So I took some time and looked at some of his complaints and saw that they were absolutely incorrect. In fact, I think that the regulations in Brevard County are far too lenient. The fact that an offender or a sexual predator can hang right outside a business that caters to kids, but is legally prohibited from hanging out from a park is just a loophole that we didn't see, and one that we have the opportunity to fix. So as much as this individual probably wouldn't like to, and I invited him here, to know that his intent was to make things more lenient, I went in the other direction, Mr. Smith, or Commissioners.
Thank you.
Commissioner Pritchett.
I'm good with it, Commissioner Tobias. We did the same thing with the animals. I have a request. You put this in here, and it jumped out at me. The county's definition of park is a publicly owned or operated area used for public use of recreation facility. I would like to go ahead and change our ordinance to say what the state does. Park, all public and private property designed and designated being used for recreational purposes and where children regularly congregate. So you put this in there, so I like what you have, and I would also like to maybe move forward and make the change in our ordinance to have the same definition for park as the state of Florida does.
Mr. Chair.
Please.
I went in that direction, but I would advise that initially that you speak with Ms. Bentley, because the more I thought that was an easy fix, but the more we looked at that, because in fact the county is more stringent than what state statute, that would actually roll back. It would have a negative, it would be positive for sex offenders and sexual predators, but it would be negative for the 99% of people that don't, touch kids. So again, that sounds good, but unfortunately that would have the exact opposite effect. And your one constituent would be very happy. However,
I know what you're saying with what you want to do with that, but I mean, all we did was expand it, and it's adding in the sky zones and stuff, because the sexual predators or people that have that, I have to do background searches all the time on people. They know they're not supposed to go to specific places and as parks, but if we expand it out to private property where kids typically congregate, we have just put an extra bit of teeth as far as county. But I also know you've taught me this through the years. Whatever the state mandates, the county can't do less. So we're kind of under that anyways, correct?
So what the state does, to give you an idea,
okay,
is they say you can't live within a halo of a park. They don't necessarily say you can't congregate. The county has taken that as a congregation and then expanded it from the 500 to 1,000 feet. So if I'm mistaken of what I have heard from the county attorney's office, and that in fact goes to solve it by making our ordinance more strict, I certainly would support it, because it's a heck of a lot easier. But unfortunately, I'm not an attorney, but from what I was told, that would have the exact opposite effect.
okay. You have me hesitating. It was just something I thought of, and if I could have picked up the phone and done this, not looked dumb, I sure would have. But okay, so I'll spend a little more time looking at that.
And I would say speak with Ms. Bentley. She can, because she's.
I can't quite see you, but I think we can probably look at the state definition and address both issues in a draft, and maybe we could circulate that and get that moving as quickly as possible, assuming we don't have any additional problems. I understand the intent. You want to go with the state as much as possible, and yet not weaken the regulation. You want to strengthen it.
Correct.
I understand
if
the
they were
goal.
not mutually exclusive, I would be more than willing to add that.
Okay, and thank you for advocating for the kids. I'm always going to err on the side of the children and the vulnerable population, and I really appreciate you looking into this.
Commissioner Tobias, I'll jump in if I may real quickly. And I think that the thing to keep in mind is when you're talking about sexual predators, you're talking about someone that would otherwise qualify as a sexual offender, but they've been convicted of at least 2 second-degree felonies of that nature or 1 first-degree felony of that nature. So to me, that's a clear problem. That's a clear danger. But, using your example earlier, if you have, to talk about just sex offenders, if you have an 18-year-old that's working in a convenience store and he sells a Playboy magazine to a 16-year-old kid, it's possible that person may be a sex offender. But to me, quite frankly, I don't know that that rises to the level of concern that I now want to prohibit them from accessing places they otherwise should be able to access. Predators, of course, that's a different story. That's why even on the license, there's a different designation based on a different state statute to identify someone as a predator versus an offender. The level of risk for a predator versus an offender is night and day in my mind. I don't want to punish someone that did something stupid like sold a Playboy to a 16-year-old who might have looked 18, and that was the be-all, end-all. So I would certainly support it as to predators. I don't think I would support it at this juncture as to offenders. I do see we have a handful of cards on this, so if you want, maybe now is a good time to take those.
Yes, may I respond?
Please.
Yeah. First of all, your issue, an example, and I'm not an attorney, but you understand it better than me, but the thing I do understand is it sounds like your complaint isn't with Brevard County, it would be with the state of Florida. So I would encourage you to get in contact with your state representative, whether that be Randy Fine or Thad Altman, and explain that maybe that should be rolled back. That individual that inadvertently does that and lands on a registry is prohibited from being in a park right now. So I understand your concern. I don't necessarily agree or disagree with it, but that is something that would be handled best at the state level. I'm pretty adamant of having, as you know, as an attorney, many charges are pled down. So I don't want to know what actually happened and what the outcome was. So either one scares me, and I would not want my daughter or any of my nieces and nephews, I wouldn't make the distinction whether they're a predator or offender. If it bothers you that much, what I would be willing to do, and we did this carve out for you on the alcohol, if you wanted to create a sanctuary area for sexual predators in your county commission district.
Not predators.
Okay, or offenders in your county commission district. I would vote for it and encourage all minors to not go to your Lori Wilson Park without close monitoring. So if you want to do that tear out, I certainly would.
I don't know this is one that I would really be in favor of a tear out on. I mean, my thought is this is really something that impacts folks in my district and other districts the same. I mean, I've gone to other districts' parks myself. I've had other people in districts other than my own come to my district's parks. So the problem is it's going to impact D2 residents regardless. But let's go to the cards. Maybe we'll hear something that'll change one of our minds. All right, I'll give you all the order just so that we can have everyone lined up and on deck. First, we'll have Chris Marshall from Palm Bay, then Shannon Stewart from Merritt Island, Teresa Bond from Merritt Island, Dylan Burling from Melbourne, and Karen Burling from Melbourne in that order. So let's start up with Mr. Marshall. Chris Marshall. Going once, going twice, going 3 times. All right, how about Shannon Stewart? Nope. Teresa Bond? Promise it's different handwriting. It's not all the same person punking me here. Dylan Burling? Karen Burling? That must be a first. That is bizarre. Well, I didn't hear anything that changed my mind. Oh. Do you not have do you put one in for a different item, or? Okay, if you come on up, if you would, please just put your name and your city of residence in the record. I'd appreciate that. Yeah, I'm sorry, I just looked through, and that's all we had.
Jason Perez, I reside in Melbourne, Florida.
Oh, hang on, let me get you on. Okay, so Jason Perez from Melbourne. All right, sir, I'll give you the floor.
Okay. I'm bringing you down to reality. I'm not a sexual offender, but my loved one is. For the past 6 years, I've been residing according to the Brevard guidelines regarding this, and I 100% oppose this. You're right, it is stricter than what the state is, and now you're going to try to make it stricter. You can't.
Sir, I'm sorry, I'm going to restart your time, but could you start up just so she can hear you?
Can I bring that up?
Yeah, maybe just get a little closer to it or speak up some.
I've been living this life for 6 years. I'm not a sexual offender. I do have 5 kids, and I have to live by these rules every day because I'm worried that whatever the case may be. Anyways, I oppose this 100%. Like, it's bad enough that my kids, I work 2 jobs and go to school. I have to take my kids to the park because my significant other can't. Do you know how hard it was to find a home within Brevard alone in Melbourne? Because within 1,000 feet, do you know what the average baseball field is? Can you see, have you ever sat behind home plate and looked at the outfield and identified if it's a male or a female or a child? All right, and now you're gonna add 1,000 feet to that. So it's bad enough that she's already restricted, that she can't go to certain areas. She can't shop for certain food. We have to travel from Melbourne, or she has to travel from Melbourne all the way to Cocoa to go food shopping, okay? I know people that live behind a dumpster at Home Depot because they're sexual offender and can't find a place to live. And now you want to impose this on businesses? Where is she supposed to take my kids to? Where are my kids going to be restricted to? How are they going to spend time with their mother outside of the home? How is that even fair? You can't justify what someone did, as you brought up earlier, for a Playboy versus what someone did in a public bench. There's no classification as to, besides just predator and sexual offender, that's it. A crime is a crime. You have crime, you have different types of level of crimes. Felonies from class A, or from A to D, and the same for misdemeanors. But you don't have that for sexual offenders. So you're judging everyone for one action that they could have done 20 years ago, or one time, or one off. And I get it, I understand your concern, you're trying to move, you're trying to do better for the community, you're trying to protect the kids. I'm all for that. And because of what one person did in one county, now you gotta spread it out for everyone else? Like, how is that even fair? Kids congregate everywhere, video game stores, shopping centers, parks, anywhere. It doesn't even matter. The only place they don't go is to bars. So what you can do, restrict everybody into, you can't go anywhere but a bar. She tried to work at a bar, it can't even serve alcohol. So she can't even be a bartender. So what is she supposed to do? How is that fair? As a father, I have to work 2 jobs, go to school, and be a mother at the same time, just so my kids can have a decent life. And this is just, I 100% oppose this. That's all I have to say.
Thank you, sir. Commissioner Tobias, do you have any questions for him?
No, but I thank you for coming. I can't imagine the courage it takes to get up here and stand up for the rights of sexual offenders. That had to be extremely tough. But I, as a policymaker, am more concerned about the 2 classes of people, those that committed sexual offenses on minors and those that didn't. And I'm more concerned with the 99% that are in the other side. And let me read Florida, when dealing with sex offenders, let me read you a statute. And statute is kind of interesting here because the legislature put an intent. Normally, that's not done, but they did in this one. So this is section 944.606. The legislature finds sexual offenses, especially those who have committed their offenses against minors, often pose a high risk of engaging in sexual offenses even after being released from incarceration, or commitment and protection of the public from sexual offenders is a paramount government interest. Sexual offenders have a reduced expectancy of privacy because of the public's safety and its effective operation of government. So it's not me, it's not only me, it's the legislature that has an intent that when a person is found guilty of these offenses, you give up rights. And having to drive a little bit longer to go to Publix or Winn-Dixie pales in comparison to, and I don't want to know because it would hurt me to even understand that people can commit these crimes on young folks. Whatever innocence was taken away from people that don't deserve that. So again, thank you for showing up. Clearly, many folks didn't want to, and I do mean that from the bottom of my heart. It takes a lot of courage to get up here and advocate on behalf of the rights of sexual offenders and sexual predators.
I do have one question, if that's okay.
It's up to Commissioner Tobias on this.
The chair.
Up to you, sir. What would you like?
If this passed, not only do these people have a 1,000 feet restriction on parks, but if this passes and every business sign up, where would they be able to go in general?
Where would they have the ability to go?
Anywhere,
to
shopping.
a business that was not 1,000 feet within an area that the children congregate. And
It's limited now. What I'm saying is that what life would they be able to do with anything, just anywhere? That's my
again, so I have a choice. I have a choice to look out for the 600,000+ folks in Brevard County that have made a decision not to have a sexual offense on a minor, or I have a decision to look out for the 867 folks that have made a decision, a bad, horrible, terrible decision to have committed a sexual offense on a minor, whether that be a misdemeanor or a felony. As I explained, even the misdemeanors sound pretty horrific. To me. So that's not my question. Is to look out again for the 99% of people that make good decisions, not the 1% of people that make bad decisions. Especially when the legislature says that 1% has a higher propensity to engage in that same terrible activity over again. Again, not me. Florida Statute 944.606.
I would suggest that you at least look into how someone
Sir,
becomes.
I apologize, but
All right,
I can't have the back and forth. If I could, I would, but I apologize.
And this is just permission to advertise. So to be clear, no matter what happens today, there would be more opportunities for the public to come in, and nothing is, even if this does pass, it's not immediately going into effect. The chair can explain that. So there would be other opportunities.
Thank you.
All right, Commissioner Pritchett?
I just wanted to state, I believe the intent of this, if I'm right, Commissioner Tobias, it's, you have parks where kids hang out, but now we also have businesses that are made specifically for children, the Sky Zones, the video places. And I know things are tough, but the goal is to reduce the risk and the danger to the vulnerable population. And I think sometimes we do certain things, and again, you serve your time and whatever, but that doesn't mean you haven't lost the privilege to be able to do certain things. If certain things that we do in society negate safety to other people because of what we've done, then it's just something you've just got to deal with and figure out. So sir, my heart goes out to you. You sound like a wonderful father and a person. And, with some things that we try to bring some kind of leadership to, there's always going to be a couple people outside that don't fit in these categories, but you've got to do what's best for the majority. So I still am probably, well, I am. I'm going to support this moving forward, and I hope we change the definition.
And Commissioner Tobias, I'll just reiterate my prior concern, and I agree. Ideally, the legislature up in Tallahassee would adjust things so that someone who sells a porno mag to a 16 or 17-year-old isn't potentially labeled a sexual offender for years to come. But, the fact is I've got to operate here with what the law is that's in place right now. And I don't see further penalizing folks that are marginally on that list for reasons such as the one example that comes to mind. Certainly sexual predators, when you're talking first-degree felonies or multiple second-degree felonies, there's not really much of an excuse out there for that. I have no problem implementing the restrictions that you'd like to see with respect to that. But simply for offenders, given that there are a lot of people, I think, that get swept into that category that, frankly, if you listen to the circumstances, they wouldn't be traumatic for you to hear. I don't know that I can support it on that. You know, I'm sure the politically popular thing would be to crucify all of them regardless, but I just don't think that's the right thing to do in this circumstance. So, you know, you may well get it to pass either way, but if it doesn't pass with with offenders in the mix, you know, make a motion right after to do it with just predators, and I'll support that. All right, Commissioner Pritchett, is that an old one?
I have a question, Commissioner Lober, because you do bring up a good point. The item that Commissioner Lober brought up, is it possible for them to come off of the sexual offender list?
Please.
Yeah, I'm not 100, you know, that's covered under section 943.04354. I'm not an attorney, that's where it's located, and that deals with the age difference of, you know, there's a whole bunch of qualifications on there, you know, and I'm not an attorney, so I don't know. But I do want to reiterate that, remember that many of these offenders have pled down in order to become an offender. They have many effective attorneys, I imagine, as well as some of the offenders, transmission of child porn, knowingly selling obscene material to minors. It's not just you know, Commissioner Lober mentioned accidentally selling. That's not, Florida statute is knowingly selling someone. So that is different. And sexual misconduct where the victim is in a facility for the disabled, that's I can't believe that's not a predator, and that may be my fault for not fixing that when I was up in Tallahassee, but that is what would get you on the offender, not the predator list. And if you have a question, just put yourself in that situation. Do I want my child, or do I want do I make that difference, that my kid is okay with an offender and not a predator? I tell you the decision I make, and it's reflected in the ordinance.
Now, I can tell you with respect to that, as far as knowing, if you look at the actual jury instructions for that charge, there's nothing that requires explicit proof that they knew. I mean, you can infer that, and I got to tell you, I mean, you get the wrong jury, they're going to make the inference regardless. That's the concern that I have, and I don't want to do something that's going to unreasonably punish certain individuals that, quite frankly, are already on a list that I think the folks who put in place that list wouldn't necessarily want them to be on.
Mr. Chair, so we created a registry, and I hate asking this, but you're the one that brought it up. We created a registry for people that abused animals. So let me get abusing a child is not as worthy of a registry, but abusing an animal is. And this comes different, right? Because you don't have, to the best of my knowledge, you don't have kids, you don't understand. I don't have animals, I don't understand. It's just a policy, it's just a policy difference that we may have. I'm just trying to, how do you explain why we have one for animals, which I think I voted for it. I don't think abusing animals is okay, but I also think that abusing kids is just as bad, if not worse.
I don't think you voted for it, but be that as it may, so if you want to say it's analogous, then stick with your prior position.
I don't think that is similar. I don't think they're similar. I think abusing kids.
You're talking about animal abuse and child abuse. Sure, child abuse, if you want to say that that's, no less evil than animal abuse, fine. I'm not going to argue with you on that, but you're not talking just about folks that have abused children. I mean, I'll just go back to the same example so we're not, throwing out 100 analogies today. But you get someone that sells a Playboy or a Hustler to a kid that's 16 or 17 years old. Maybe the one that's selling it is 18 or 19 years old. Is that really something where you will now want them prohibited to go to certain places as a result of that? I don't know that really benefits anyone.
And I don't understand the jury, Mr. Chair. I don't understand the jury. I just know what Florida statute says. And it says clearly knowingly selling obscene. I'm not a judge. I'll never be a judge. But that's what statute says. So you know, I don't know the fancy words that a defense attorney would use or the instructions the judge would, but I can read state statute, and that's what it tells. And I honestly believe that if there's a mistake made, that you probably can answer this, and I don't want to get into you know, a defense attorney is probably going to, you know, if it was a sheer accident, probably go in a hope for a different outcome.
Well, here, let me give you, for the sake of the hypothetical, let's say you have an 18-year-old kid in high school and a 17-year-old kid in high school. The 18-year-old just went to the 17-year-old's birthday party 6 months earlier. They know the kid's 17. They perfectly know. Is that really in and of itself now worth prohibiting them, even if they do know? I'll give you that for the sake of the hypothetical. Is it still worth prohibiting them now from going to other businesses? Are they a risk to children? I don't know that they are.
So my suggestion would be this. There are some offenders that sexual misconduct where the victim is in a facility for the disabled. I mean, that is an offender.
Yeah, I'm good with including that.
So my suggestion would be is let's advertise this, and if there are certain statutes that you don't think meet that threshold, maybe we can pull those one or two out. I would not be necessarily opposed. But to throw the bathwater out, I do not want someone that has sexual misconduct where the victim is in a facility for I can't even believe that doesn't put you on the predator list. I don't want kids to be in that general vicinity thinking that they're going to have a good time in a private business. We protect them in a park. I think that equal protection should be at a private business private business that caters to those same kids. So I would be open. You'd have my commitment if
That's fair.
To do that.
I'll support it in that case. That's fine. Commissioner Zardy?
Yes, this is, again, and I think it was stated more than once, this is just permission to advertise. So we don't have any more cards on this, correct?
No, we're thrilled.
So I would like to see myself, since it's just permission to advertise, some options. I definitely will be highly supportive of this. Again, I think I touched on it a little bit, my history with this, and I had actually was going to move forward with something much stronger, talking about putting signage in sexual predators' front yards. Imagine that, right? But it's been done in other places around the country because just look up the definition of a sexual predator under our state, and you'll understand why you wouldn't want your children anywhere near them. But anyhow, I'm happy to support this. So with that, I'm going to call the question so we stop talking about it. So I'll make a motion to move forward for legislative intent on Commissioner Tobias' item.
Second.
All right, a second from Commissioner Smith for Commissioner Zardy's motion regarding Commissioner Tobias' item. All in favor, and again, this is just the advertisement, say aye.
Aye.
Aye. Any opposed? All right, the advertisement passes unanimously.
Mr. Chair, in the meantime, if you wouldn't mind identifying those areas that you think wouldn't be worthy, and my understanding of Sunshine, the same way you sent out the memo, if you could send those out so we could discuss them.
I'll do it that way. Just don't reply to me, and don't even acknowledge you got it, and that's fine.
Thank you,
And I'll
Mr.
have
Chair.
the clerk add it to the minutes again. Yeah, do you want me to take a few?
Just 3 minutes.
I'll give you 5. I'm not going to make you run. I want you to wash your hands before you come back. All right, we'll reconvene at 11:50. Let's call it 11:53.